Hey friends, welcome back to the channel. My name is Justin Elsner. Today I want to talk to you about traumatic brain injuries. So traumatic brain injury is commonly referred to as a TBI. And what that is when some sort of violent action has happened either inside your head by the brain shifting in the skull, or there's been a significant impact to your brain. And so we see this in usually two situations in our practice. That's in a slip and fall type of case where somebody falls and hits their head on the ground. And the second one is in a motor vehicle collision. And in these types of injury causing events, a traumatic brain injury appears in different ways. In the most severe situations, somebody might be in the hospital for an extended period of time and they lose a lot of function in their daily life. They have trouble remembering who they are, where they're at, how to eat, how to walk, and have to learn those things all over again. On the other side of things, we see brain injuries that aren't as impactful in people's daily living, but they still have a significant impact on somebody's ability to enjoy their life. And so what does that look like? So diagnosing a brain injury, especially when there are other injuries, can be very difficult. Oftentimes we see that an emergency room doesn't even diagnose a brain injury. They're focused on making sure you aren't dying, and other things are secondary to that. And so then it becomes your second level of providers that end up diagnosing a traumatic brain injury. And why it can be difficult is if you've been in a car accident, for example, your head might hurt, your shoulders, your back, your neck, and those can all be causes of headaches, for example. And so a provider might think that your headache is just because you have pain from your muscle and ligament damages. But it could also be a brain injury. And so what do we look at for determining if somebody has suffered from a brain injury? So this can be a wide range of things. Some of the most common things are headaches, like I mentioned, but also different things including a change in attitude. Maybe people don't want to go to work, they don't want to participate in activities and hobbies, things that they enjoyed before. It can lead to depression. People have all kinds of frustration, they're not getting better, they don't really know what's going on, and so they become somewhat reclusive and depressed. Additionally, we see things in changing of your mindset. So you have a hard time remembering certain things. You might have to start taking notes to remember basic things that you could remember before the injury causing event. I also find that people have a hard time finding words. Like something that might seem like a word they use all the time and now they can't think of the word. Maybe they have trouble doing tasks at work, so something that maybe they could do in a couple of hours would now take them all day. They have problems remembering appointments and remembering to do basic things around the house. We also see mood changes. So somebody might get angry all of a sudden and they weren't like that before, or they get really frustrated and so they are having difficulty getting along with friends and family. They might be fatigued. They might want to give up on tasks, generalized confusion. And a lot of times these types of things people don't recognize in themselves, or they want to have a hard time admitting that they're struggling with their job or struggling to get by in life. And so oftentimes we'll talk to family members, and the family members are able to more objectively see the change in this person since this event. So what's important then when you start noticing these things is to document them. I invite you to do a simple Google search and you'll find lots of checklists for traumatic brain injury symptoms. And recognize those different symptoms, keep track of those, document those, and then discuss that with your medical doctor. Because when they understand the full list of the way your life is impacted, then they can better assess you and make recommendations from there on the type of treatment they think is going to be most effective. Highly encourage people not to just sit around and wait and think, oh, this is going to get better, this is going to get better, because oftentimes people let their brain injury symptoms just linger for months and then they get worse because it has been an extensive period of time and now that depression really has been sitting in, or they're having trouble at their job, or maybe even getting terminated because it looks like they're just being lazy or what have you. So I definitely recommend that people talk to their doctor about it. If at the end of the day you've been in an injury-causing event and you're needing legal representation, we're happy to give you a free consultation, so I invite you to reach out and talk to us. Thank you.